a drug called chloroquine, and some people would add to it hydroxychloroquine. But the nice part is it's been around for a long time. So we know that if things don't go as planned, it's not going to kill anybody. I happen to be taking it. I'm taking it, hydroxychloroquine.
When?
Right now, yeah.
Yeah, when?
A couple of weeks ago, I started taking it.
Alors maintenant, il y a un traitement qui vient d'être proposé par les Chinois, qui était un traitement qui était prévisible, hein, puisque la chloroquine, c'est un médicament qu'on utilise depuis très longtemps pour les bactéries intracellulaires qui se multiplient dans les cellules comme les virus. Hein. Donc on l'utilise depuis 30 ans, qu'on connaît parfaitement, on en connaît le dosage, on connaît tout. On avait écrit avec mon collaborateur Jean-Marc Rollin que la chloroquine était probablement un médicament d'avenir dans les infections virales il y a 10 ans de ça. Hein.
And that's where the FDA has been so great. They've gone through the approval process. It's been approved.
There's been some promise with hydroxychloroquine, this potential therapy for people who are infected with coronavirus. Is there any evidence to suggest that, as with malaria, it might be used as a prophylaxis against COVID-19?
No, the answer is no. And the evidence that you're talking about, John, is anecdotal evidence. So as the commissioner of FDA and the president mentioned yesterday, we're trying to strike a balance between making something with a potential of an effect to the American people available at the same time that we do it under the auspices of a protocol that will give us information to determine if it's truly safe and truly effective.
We're also implementing the trial drug. We have secured 70,000 hydroxychloroquine, 10,000 Zithromax, from the federal government. I want to thank the FDA for moving very expeditiously to get us this supply. The president ordered the FDA to move, and the FDA moved. We're going to get this supply, and the trial will start this Tuesday. The president is optimistic about this, about these drugs, and we are all optimistic that it could work. I've spoken with a number of health officials, and there is a good basis to believe that they could work.
With those tests being approved for Abbott and for others, these are available around the country. They're planning to scale up.
This weekend,
we actually worked to secure 30 million tablets from Sandoz and 1 million tablets from Bayer of hydroxychloroquine and chloroquine, which are potential COVID-19 treatments.
The good news is we haven't heard anything bad. In other words, there have been no catastrophic events. But we haven't, it's a little bit too soon to talk about it. It would be a total game changer, John, if that happened. If that happened, it would be a game changer.
So the drug might have some benefit in some populations, but we won't know that until we have that information from a truly randomized controlled clinical study. Many of those studies are ongoing now. Some of those studies we're starting to see data from, and those studies in those populations tested haven't shown an overwhelming evidence of benefit from the use of hydroxychloroquine in those patients.
Recommend that you take that? Is that why you're...
Yeah, White House doctor. I didn't recommend. No, I asked him, what do you think? He said, well, if you'd like it. I said, yeah, I'd like it. I'd like to take it.